For the management of premature rupture of membrane, we still start with the SchrDbb algorithm. We're going to manage the disease by treating the mechanism of the disease. Then we manage the cause. Then we manage the complication, and then the background and the cause are actually related. Is it clear? And you have also the prognosis if there is any. So now let's talk about the treating the mechanism of the disease. In this case, treating the mechanism of premature rupture of membrane. Now, the mechanism of premature rupture of membrane is actually that what there is going to be an increased loss of amniotic fluid. The mechanism of premature rupture of membrane is that you have an increased loss of amniotic fluid, and with respect to a production, we have an increased loss of amniotic fluid with respect to production of the amniotic fluid. Is it clear? You have an increased loss of amniotic fluid with respect to the production of amniotic fluid. So to manage this with this principle, you need to do what? Increase production. You need to do increased production of amniotic fluid. Is it clear? Or perfusion of amniotic fluid. And you also need to reduce the loss of the amniotic fluid. Is it clear? Now, how do you do both of them? Let's start with the first one. How do you do increased production of amniotic fluid? That's where you now need to do fluid rehydration of the patient. Is it clear? You need to know that what? You need to know that generally 1 liter of fluid can produce 250 ml of amniotic fluid. So you have to, the woman has to take much fluid, something like 4 liters per day. Is it clear? She has to take about 4 liters or even more per day in order to increase the fluid rehydration. Is it clear? That's the general measure that you can do in order to do that. Now, the next one after the fluid rehydration, we have also interventional measures. Is it clear? Interventional measures, or you can still say there's pharmacological measure. Is it clear? In this case, we do an amnio infusion where normal saline 0.9 can be directly infused into the amniotic fluid. Is it clear? It can be directly infused in the amniotic fluid such that the child should be perfused with the amniotic fluid. Is it clear? So those are the general measures for increased production of perfusion of amniotic fluid. Now, you need to know that the second measure was that you should reduce the loss of amniotic fluid. So a major method in order to prevent the loss of amniotic fluid is by the general measure is that the woman should be lying down with leg raised. Is it clear? They raise legs. Is it clear? When the woman is going to raise her legs, the fluid is not going to come out by gravity. So it's going to prevent the increased loss of the amniotic fluid. Is it clear? So those are the general measures that we do in order to treat the mechanism of premature rupture of membrane, which is increased loss of amniotic fluid with respect to the amniotic fluid production. Is it clear? So that is the first element that we have to do. Now, the next element is to treat the complication if there is any. Is it clear? Now, we had different complications of premature rupture of membrane. So the next one after this, now you are going to have. So when you have the next one, you have now to manage the complication. Is it clear? You have to manage the complication. Now, when you're managing the complication, we need to bring out that there are different complications in the case of premature rupture of membranes. Is it clear? So there are different complications. Now, the first complication that we had was oligohydramnios, and we have already treated the complication of oligohydramnios by increasing the perfusion for the formation of amniotic fluid or by reducing the loss of the amniotic fluid. Is it clear? So we have already treated the oligohydramnios in that case. Now, let's say that you have a patient that has an acute fetal distress. Is it clear? When a patient has an acute fetal distress, the immediate management is going to be a cesarean section. Is it clear? If a child has acute fetal distress, the immediate management is cesarean section. If there are fetal malformation, other management has to be done out of the uterus when the child is already born, and it can be things like surgery. Is it clear? Now, when the child is premature, provided that the child, you have to evaluate if the child is less than 34 weeks of gestation. If the child is less than 34 weeks of gestation, we need to do the bubble shake test. Normally, we need to do the bubble shake test, or we need also to do the lecithin sphingomyelin ratio, which is going to tell you if the lung is mature or not. But in our context, we don't have those tests available. So every time a patient is less than 34 weeks of gestation, we need to mature the lung. We consider that that fetus is not having lung maturation, and we mature the lungs. Is it clear? And how do you mature the lungs? So for the lung maturation, we use corticosteroids. Is it clear? You use corticosteroid, and for corticosteroids, it can either be betamethasone. You can either use betamethasone or use dexamethasone. Is it clear? Now, when you use betamethasone, you use 12 milligram. Is it clear? IV or IM, but it's mostly used IV. Is it clear? 12 milligram. A single time per day, one time per day, for 48 hours for 2 days. Is it clear? You give betamethasone 12 milligram one time per day for 48 hours. Sorry, so for 2 days. Now for dexamethasone, you instead give 6 milligram IV or IM. Is it clear? IV or IM 2 times per day, so that it should attain 12 milligram per day, and it should also be for 48 hours, that is for 2 days. Is it clear? That is going to help for the lung maturation. Is it clear? Now, after the lung maturation, so we have done corticosteroid, we have the lung maturation, that is in the case of immaturity. Now, provided that you think that the child has an intrauterine growth restriction, is it clear? The child is small for gestational age. What you can do is that you can induce labor. So in the case where we have the first element where the child is instead greater than